but it's one of the reasons why people get really severe lines sometimes, is that they've lost so much volume in their mouth that the orbicularis oris is very dominant, and it causes many, many lines while they're just sitting, resting, doing nothing. So where can you inject, if you think about it this way? There are essentially three zones you could think about. You've got the lip body. That's the main part of the lip that we treat in most younger people where you're adding volume. You then have the retroorbicularis oris fat pad, which depletes as most people get older. It's not a common place to treat, but it's one of the reasons why people get really severe lines sometimes, is that they've lost so much volume in their mouth that the orbicularis oris is very dominant, and it causes many, many lines while they're just sitting, resting, doing nothing. And that's often the fat pad underneath, which you can treat as well. And then you also have the hypodermic fat above the muscle. Included in the lip body, by the way, I'm also including the defining point, so the vermilion border you would also treat alongside that. But the hypodermic fat where the lines are is another place that you would commonly treat if you're trying to restore a lip. Now, if you treat just one of these to completion, so you get rid of all the lines in the top lip by treating just the hypodermic fat area, you're quite likely to cause disharmony in some patients. So they start to look like there's something unnatural about them. Unless you're extremely conservative, which is definitely an approach. Some people just need a little bit, get them a little bit improved and they're happy. If you treat all of them without treating the whole face, then you have the other issue, but involving the mouth not quite fitting in with the face. So all of these need to be built into context. And if you're not going to be holistic, you have to use small volumes and put up with a smaller end result, a smaller difference in the end result. Because the more perfect you make the mouth, the more likely it will stand out as having basically different levels of volume to the rest of the face that it is integrated into.